Woman to woman, let's be honest, do you dread having to make your annual appointments or even go to the doctor while you're juggling work and home and kids' schedules? It's nuts, right? Well, what if I told you there was a company in Central Illinois that could change the way you manage your personal health? Femcare Health out of Morton, Illinois is a BBB accredited business, and they are flipping the traditional healthcare industry upside down and inside out with an effort to care for you specifically. They do home care health for women specifically. They do primary care, gynecological care, mental health care, all of the things that you need in the comfort of your home. And I think the great thing about Joe and Eric is they are so passionate and focused on making sure that you feel heard as a woman, particularly with your health. They want to look at the whole picture and make sure that they're managing your health as a whole. No separate doctors waiting on charts to be reviewed and appointments that are weeks and weeks out. I want you to hear about Femcare Health out of Morton in this next interview. I guarantee you're going to love it and just be mind blown about the possibilities of managing your health. Be a better business. Well, thanks for joining me today, you guys. I want to dive into this whole concept of home health care and how you guys came up with this idea. So tell me the story of Femme.
I did, throughout my career, I've worked a lot in mental health, working with individuals with developmental disabilities. And so I did a lot of nurse care management. I did a lot of attending appointments, setting up appointments, following through with the offices after we saw them. And it was very frustrating because we'd have issues going on and we'd call to get an appointment with the doc and it would be like, well, we can get you in 3 weeks on a Thursday at 4:45. And how many people are able to just make that all of a sudden work for them? Let alone people that are working, people that have families and other things to do. So our big kind of concern we had was everything with healthcare is always on somebody else's time. It's never on yours. And it's never really truly focused on you. So our goal was to make Femcare something where you were the focus. It could be done on your time and where you felt most comfortable, whether that be virtually, whether that be in your home, whether that be we meet you at Starbucks to have a coffee and a chat about what's going on. Anything that made you feel like you are the focus in the center of your healthcare is what we wanted to make Femcare Health and Wellness.
That is amazing, amazing. So give me an array of all of the services that Femcare can offer through this home-based model.
Yeah, so we can do basically everything from primary care anything up to like specialty care of like gynecologic care. Like we can come to you in your living room and do your pap smear. We can do infertility treatments in your home. And then everything from blood pressure checks, blood work in your home, and we take it to the lab. And it's covered by insurance. We accept Medicaid. So just open up to a large group of women.
This is going to change everything for so many people.
Absolutely. We want to have Femcare Health and Wellness be a one-stop shop for women's health, where you're not having to see 3 or 4 different providers. And again, that's how much time out of your schedule running around, how many different people and sets of instructions to deal with, versus somebody that's got it all wrapped up in one. Your care is all in one. We know what's going on and can address it usually a lot more quickly than standard offices.
Yeah, the time spent in the waiting room, the time spent in the room waiting for the doctor, all of that is eliminated with this model. More convenient for everybody. Let's go into your journey from labor and delivery. What moments along the way really shaped your passion for women's health care?
I had no desire to work in healthcare. I worked in education. I was a special ed teacher for a while before, and it was really my sister became pregnant, and I at a younger age, and I just started to be fascinated by pregnancy, and I knew nothing about it. So I just started like researching it, and that's when I'm like, I want to go back to school and become a nurse, and not just any nurse. Like I wanted to work on labor and delivery. A lot of people are like, well, men don't work on labor and delivery as labor nurses. Heard that lots and lots from nursing school and even after. But then I finished, was like the first male labor and delivery nurse at like multiple hospitals I had worked at, and then took it one step further and went to grad school to become a certified nurse midwife also. And I love it. I would never look back.
What are some of the aspects of that passion that you are able to bring in to Femcare Health at home?
I think the biggest thing is I saw how traumatic healthcare is for many women, especially given how invasive some of the things we do for women's health are. So I feel like what better place where women feel the most literally at home or safe is within the home. So it was hard navigating that, because some of it is not just women choosing a new provider, it's choosing a whole new model of care. And that's, I think, probably 75% of the struggle is you can't do a pap smear at home. It's like, we can absolutely do a pap smear at home. Why do you have to be in stirrups with a paper gown in a freezing cold room to do it? There's no reason for that. So it's just changing the model, and I hope I hope other companies try and replicate what we do, because it would just mean better health for so many more Americans.
I mean, that's how healthcare used to be. The doctor used to come to you, you know, you'd have your baby at home and everything at home. So. Yeah.
If you were sick, they would come to you, and I think corporate healthcare has really guided us away from that model, more for profit, less from patient care and satisfaction.
What's some of the feedback you've had from your patients that have, you know, gotten to stay home for this stuff?
Shock. Sometimes, like, what else do I need to do? When else do I need to come in? It's like, you're good. You're done. Like, we got your exam done. We got your meds filled. Whatever it is, like, that's what it is. Oh, so I don't need to, no. Like, so some of it's just fighting against this model, decades-old model of healthcare.
I'd say also we don't do just standard business hours. We do some nights. We do some weekends. We make things happen for people. If we can't find a time that works, we're going to find a time that works and make it happen for somebody. So it's, again, not having to fit your life around, around this healthcare. Healthcare is fitting into your life. Very much. And that is how it should be.
What are some common myths that you see women believing about health, their own health?
Well, something that's very popular right now, weight loss. That weight loss medicine is a crutch, or you're weak if you need it. I think that's a big one, because so many people, so many Americans especially, are struggling with their weight, which we know that increases diabetes, high blood pressure, I mean, everything, early death, cancers. And while a lot of clinics will offer medication-assisted weight loss or support, I mean, I lived it. I went through it and lost 140 pounds with it. And we do it more as a health model instead of a cosmetic model for weight loss specifically. There are multiple benefits to losing weight, not just how your clothes fit. And we're not just, yes, we ask people how much they've lost it, like follow-up appointments. But I'm like, the first question I ask is, how are you feeling? Like, what are you feeling? And that sometimes takes people back, because a lot of women especially are not really asked to give their feelings. They're asked just to give very subjective data that might not even be taken into account. So we definitely want to make sure that we're listening to women and doing what they actually are saying they need, instead of just what we think that they need.
And I think a big one we hear quite a lot is women come to us that have seen previous providers in the area, and that they're just not listened to. They, a big thing I hear, we work with, hormones in women that are, perimenopausal. And, a lot of these doctors are telling, well, this is just part of life. Just deal with it. Like, that's, and even female doctors telling, female patients, well, I went through it and it's what it is. You just have to deal. And that's not really an acceptable answer when I'm coming to you looking for healthcare options to tell me to just deal with it. I could have stayed home and saved my time and my money to just deal with it. I'm coming to you for answers, and that is absolutely what we're going to provide. I am very big into, it's a conversation between all of us. We're a team working together, and your input, your ideas are just as valuable. Just because we, have gone to school and have some training, this is your health, your body, your life.
You're in charge.
Absolutely.
Joe, with your expertise in mental health care, what do you think it does to a woman who's feeling miserable, can't explain it, is trying things that they believe will help, and they go to a provider and they're given that answer, there's nothing wrong with you? What does that do?
I have not been in that situation personally, but I can just imagine feeling terrible because of it. Again, I'm coming to you for help. You're the professional. I'm spending my time, I'm spending my money, and I am looking for guidance from you. And, from a mental health aspect, we see a lot of physical issues are tied to our overall mental health as well. If we're feeling depressed, we're not feeling the best overall, and then we start to see the physical aspects. Or if we're having physical things going on and we're not being listened to, we can start to feel depressed and start to feel worse. So definitely a very strong correlation between mental and physical health, both ways with it. And so I don't think if you're not willing to focus on both, you're missing half of the story with your patient and half of what you can provide in care.
And regardless of what you come here for, whether it's weight loss, hormones, primary care, specialty care, one of the first questions you're going to be asked is how you're feeling mentally, because one, it's missed by most providers. Even sometimes going in for a depression check, you don't really tell them how you're really doing. And that can be life altering for the better or the worse if a provider doesn't ask that, because that could be the only time that person's going to feel safe to say that they're struggling or they're in a crisis. And that could be the difference between life and death ultimately.
Well, going back to your example about the traditional healthcare, you're in the room in this piece of, crepe paper, feeling uncomfortable and nervous, waiting. It's not a great time to ask the question anyway. I don't think you already feel like you're bothering the doctor because they come in rushed. Okay, what is it that you need? It's like, it's fine.
This is even obvious, evidenced by white coat syndrome is when somebody goes in and their heart rate's up, their blood pressure's up, they're breathing fast. Something about it is very anxiety ridden, and the medical community caused this. We caused this trauma that not just women, but everybody has to deal with, but especially women, given how intimate a lot of the exams are. And really, it's only the healthcare system that can ultimately change it by changing the model of care. And just by how much we have taken off, we see that women are hungry for something different, something better.
And I also think, our whole business model is giving that time for women to be heard and have their appointment and be able to talk and freely and get everything out. It's not like at a lot of offices where, the doc comes in and you have 25 people to see today and you have to get through them by 5 o'clock. No, we schedule it so that everybody that sees us has enough time to feel comfortable to discuss their concerns, to have the conversation about treatment or where to go further, to ask any questions, and to just know that they're being heard and not rushed out, and that the provider's not already thinking, hey, I'm on to the next patient already and just let's wrap this up. But feeling that you're really getting the most out of your visit and leaving feeling happy and that it was productive towards your overall health and wellness.
You guys have put so much thought and effort into designing this business to create a relationship with your clients, a really meaningful one focused on their health and building trust with them along the way. Tell me about how accreditation has been part of your business journey.
It definitely gives us the standing and the validity that we are a reputable company. Whenever a new company starts with no reviews, no patients, it's hard to get off the ground. We're asking women to let us into a very, intimate part of their life. And some of that just takes trust and what the Better Business Bureau offers us of you are a reputable company. You are, we have looked into you. And
the Better Business Bureau has been around for so long. And I even remember my grandfather was very back even in the day, did as much research on products he was going to buy, businesses he was going to be part of. And I always remember hearing about the Better Business Bureau. And when you see that, you know that a business is reputable when they have that seal and that accreditation through the Better Business Bureau. And so to us starting out, that was a huge win for us to be part and get involved with the Better Business Bureau, because the backing, the support, the that confidence that people get seeing the Better Business Bureau associated with your name and knowing that your business does things right, that there's the checks and balances with it, and that, you know, ultimately it's, you know, the Better Business Bureau is not going to stand behind anybody that's not providing a good service, a good product. So it's huge, especially for a new business, to have that the Better Business Bureau standing behind us and having the support with them.
Wrapping up, is there anything else you wish women knew more in their health they don't today?
I think women can know that you can be in control of your health. You don't have to go in and let providers speak down to you. You don't have to feel dismissed because your concerns don't seem important to the doctor, because the doctor's not the one going home at the end of the day and living this life. I really advocate for women to advocate for themselves and speak up, and do not hesitate. If your doctor gets upset because you're asking questions, the question I would be asking, is this the provider for me? And, you know, we really want to empower women to be able to take control of their health and know that anything that seems out of the ordinary doesn't have to be something you have to be fearful about talking about.
Right. You should feel safe talking to your healthcare provider. You shouldn't feel like a hesitation to say something because you're going to be judged. That's another thing that we pride ourselves on, is we want you to be open. We don't care what it is. Like, we want you. So many women try and hide things in healthcare because they're embarrassed, whether it's smoking or their weight or drug use or whatever it is. Sometimes or mental health, and we cannot help if we don't know. So always want people just to feel safe and like they're being heard.
And between the both of us, our physical and mental health experience, being part of the LGBTQIA plus community, I mean, we're very open and accepting to everybody, and we want everybody to feel like they have a comfortable place with Femcare Health and Wellness, that they can come and get good quality care, personalized to them, so that everybody can just get the most out of their life and out of their health and out of their wellness.
Be a better